Hello and welcome back to the Polaris Travel Health Podcast. Thanks for tuning in with us this week. This week, Jayden and I will be discussing airplane travel.
Yeah, I thought this would be kind of a good idea to cover some tips for traveling by plane, both for people who maybe have some additional health concerns or maybe are traveling with kids. So the first thing that kind of comes to mind for me in terms of plane travel is jet lag. Is there any way that you can prevent it, and how can you sort of deal with it once you start to experience it?
A lot of people will experience jet lag at some point. I guess it really depends. If you're going through enough time zones, it's inevitable to get. It can result in sleep deprivation, but which can be annoying. But I think the thing I would always be a little bit more concerned about is when you're landing in a new, unfamiliar country and you're maybe a little bit not feeling your best, and those are opportunities where you could potentially get taken advantage of at the airport, or in the cab or something like that, where you could get scammed or something like that. I think it's always a concern. With jet lag, you can never completely prevent it, but I think that there are things you can do to minimize and mitigate it. There are a few medicinal options. One that is used by some people is melatonin, which is a product which is naturally in your body, and it can help encourage sleepiness and help reset your normal rhythm to be more in line with local time. Prescription sleeping medications are also potentially an option, although got to be kind of careful about how they're used and dosages and which one. You don't want to get in a situation where you take a sleeping medicine that has a really long duration of action, longer than you would want. So as far as non-medicinal type things, red-eye flights are always probably going to be a bit more problematic. Avoiding alcohol and caffeine is probably a good call. And I think another thing that I always like to advise for people is that try to start thinking on your future time zone as soon as you can. So sometimes I realize that's easier said than done, but I think it's always better that if you start to think in the time zone you're going to, consciously kind of forgetting about your old time zone that you're coming from, I think that probably helps to some degree as well.
Definitely. So kind of moving on from there, I think another common concern when flying is the pressure in the cabin, which can kind of make your ears hurt or make your ears pop, and it can last even after you've landed in the new place. So what can you kind of do about that?
Oh yeah, I've definitely had this problem myself personally. I don't know about you, Jayden, but
definitely.
Whenever I fly, especially if I haven't flown for a while, it seems like my ears really there's a number with my sinuses and ears and that sort of thing. What will happen basically is, air in the sinuses will expand or contract during ascent or descent, and this can be painful. And sometimes, forcing a yawn or swallowing or chewing gum can help. Those are options potentially. There are some special type of earplugs that are supposed to, like, I think you had sort of done some research on this, Jayden, about there are some kind of corkscrew shaped earplug that, I don't know, I'm not familiar with them. They sound kind of interesting. What do you know about these?
So yeah, my mom has some problems with her ears from a history kind of ear infections, and she actually burst an eardrum at one point. So she has a bit of a harder time with the ascent and descent. So she uses a brand of these earplugs called earplanes, which this isn't an ad, but they are sort of like a corkscrew shaped earplug that has a filter in the center that can sort of slow the shift of air pressure as it enters your ear, which is normally what creates that kind of popping sensation. And she really likes them, and she finds that they really help her. And I think you can buy them at the airport, say at I don't know, what are they called? Like a Hudson News or something like that. And they really help her.
I'm not familiar with these at all.
Yeah, they come in like a little carrying case, and you just keep them with you. But yeah, they work really well, and she finds that they because she has had a problem where her ears won't pop for days after we've gotten to a new place, and that can be really annoying and painful. So that really helps.
Yeah, well, I've had the same kind of problem. I have some, not that we're going to start recounting all our medical maladies on here, but I've had some of the same problems where it's been the next day and I can still my hearing is wonky and that sort of thing. Although I haven't had as much problem with that lately, but I have had that happen in the past for me. It's not pleasant.
It really isn't. Yeah. So that definitely helps. If you can find some, I would definitely say I would endorse them. So, kind of moving on from there, because of how the air is recycled on an airplane, should people be concerned about things like the cold or other respiratory infections kind of being spread around as the air is basically recirculated throughout the cabin?
You know, this is always one of those things, and like when we talk about this, and you know, the airlines will tell you that the air is recycled and put through HEPA filters that can take out a lot of different bacteria and viruses and that sort of thing. You know, I think that those filters are probably pretty good, but even in my mind, you know, I have a little bit of a hard time still connecting the dots on thinking that, geez, like, what if somebody near me is infectious to some degree or something like that? Just seems like human nature when you've got people that close together. But, you know, I think that, you know, reasonably speaking, if someone's within a 2-seat range of you, I think that, you know, there's definitely a chance that there could be some kind of exposure. Right now with wearing masks, I think that obviously helps. I think we know that, you know, no matter how you feel about the, you know, the ultimate effectiveness of masks for all of these things, I think that there's definitely some benefit. But, you know, I think certainly sanitizing and washing is good too. But yeah, I don't know. How's that for an answer? It's one of those ones I find a little challenging to sort of even wrap my head around sometimes. But, you know, I think that unless you've got someone hacking their lungs out and sitting right next to you, overall, I think the risk is not super high.
Yeah, I think that we all have a story of sitting kind of near somebody on an airplane who is hacking and coughing, and, you know, obviously pre-COVID, but it's not necessarily as bad as you think it is when you kind of originally find out that the air in an airplane isn't new air, that it's being just kind of refiltered and recycled as you go. But yeah, I think another thing that is commonly brought up in relation to flying is the potential for blood clots. So how common is it to experience a blood clot during flight, and is there any way that you can kind of prevent that from happening or mitigate that?
Blood clots are fortunately rather rare. I think, Jayden, you did the advanced research and you had 0.4 cases per million passengers with a 2% fatality rate.
Yes.
That's probably seems about right. We know that it's longer flights and where a passenger is stationary for a long period of time. You know, I believe that one of the terms they used to call this, and maybe they still call it, is they used to call it economy class syndrome. If you're in a tight seat where you don't move around, that would increase your risk. It's more common in older people, people who are overweight, people who are pregnant, have existing varicose veins issues, that sort of thing. Also, even people that are more predisposed to having blood clots, like they've had previous blood clots. So it's definitely a thing, and it's you know, it's not common, but I've seen it actually happen in a previous life when I used to work in the hospital system. One of the things I did was I actually had a lot of dealings with people who had just recently been diagnosed with blood clots. And we did encounter patients like this, not very often, but every now and then we would. And yeah, it's definitely something that can happen. As far as what you can do, probably the easiest, best thing to do is to get up and walk around during a flight when you have a chance, to encourage some blood movement. You know, wearing looser clothes, compression stockings, even the non-prescription compression stockings, particularly if you're pregnant. I know when we went traveling and my wife and I, and she was in her second trimester, and she had gotten herself a pair of compression stockings because we had a pretty long flight. We were on our way to Argentina, so we had like a 12-hour flight. So she had just gotten sort of some of the regular style compression stockings and wore them when we were flying, just to be probably on the safe side. And I think it's a good call overall.
Definitely. Well, kind of on that, moving on to some sort of specific health concerns, what should people who are pregnant keep in mind when they're flying, aside from the compression stockings type of stuff?
So typically speaking, the airlines don't have tons of of specific rules in regards to when a person can fly up to a certain point. Usually at the 36-week mark, when you're really close to potentially being due, they don't really want you to fly. I think part of that concern is not necessarily for any other reason than they don't want to decrease the chance that there's going to be a baby born on the plane. But certainly, anybody flying in the last few months of pregnancy should probably, do some follow up with their obstetrician and make sure that everything seems appropriate. And as we talked about, blood clots are a risk, and I think how you put your seatbelt on, this would be something even relevant for when you're in a car. It's always good to wear it low across your pelvis. But yeah, it's generally speaking, flying is not a huge problem, but yeah, maybe a little bit of caution needs to be exerted.
Definitely. So another health concern that we might want to chat about is for people who have some form of cardiovascular disease. What should they do to prepare for flying, and what could they keep in mind during travel?
I think that if you have cardiovascular issues, but they're stable, well-controlled, nothing new, nothing different over the last while, I think you don't have to spend a lot of time worrying about it. But I think that the times that you need to be more concerned, if there is a sort of a point where maybe things are not stable, there's been some recent angina issues or some kind of arrhythmia issues that haven't really been resolved or controlled, that would be a concern. And, I think that, there's a few things to think about, and one of the things is, pressure in the cabin could potentially, cause, hypoxia potentially, but maybe additional oxygen might be needed under some circumstances, and probably good to, if you're in one of these situations, you should probably give yourself some extra time, make sure you're wearing shoes and clothes that are comfortable, and have everything kind of organized best you can. The other one, which I know you reminded me of before this, Jayden, was about pacemakers. There are some concerns about pacemakers with metal detectors. I think you should always let security know that you have a pacemaker. Usually most people even have a card that says that they've got a pacemaker, and sometimes that would mean getting a pat down instead of getting wanded or whatever it would be, but it probably would be a good idea.
Right. So kind of on that, in terms of people who do have health conditions, if there is a medical emergency in flight, how much are the flight attendants generally able to do for you?
I think this is one of the things that, as just sort of airplane travelers, in the plane, sometimes we don't really think about this, but flight attendants are highly trained up for emergency situations, whether there's some kind of mechanical problem or whatever, but also for medical situations. They have a decent skill set. They're not health professionals, but they have a decent skill set where they can help take care of a bunch of things on the plane if they need to, and also they're able to identify things that can't be handled and how emergent it is, whether we need to look at doing an emergency stopover or if we can make it to the destination. So there's always that. And, sometimes there'll be a doctor or a nurse on the plane that can potentially help. But, I think right now, kind of your go-to option is the flight attendants, and they also will have access to medical people on the ground that can help guide them as well. So they've got that. And they do have access to, a good first aid kit, which has all kinds of things in there, like different kinds of Band-Aids and EpiPens and defibrillators and all that sort of stuff. So, there are some things that are available there that can help in the air. The rate of something happening, I believe, Jayden, this is the number you pulled out, a medical emergency on 1 out of every 604 flights each year, which is actually more than I thought, and about 44,000 overall. So, yeah, that number is actually interesting. I would have thought it would be at least a bit higher than that, at least more than 1 in 1,000, but guess not.
Yeah. So another thing that I kind of wanted to touch on was traveling with kids, especially younger kids, kind of in that toddler age that really don't sit still for very long. So what kinds of things should parents be worried about, and what types of tips could you perhaps offer to them?
Well, you can travel with a full-term newborn, pretty much a couple weeks after birth. Like there's no specific restrictions that way. Of course, it does present some unique challenges, like children and infants can be very sensitive to some of the changes in cabin pressure, and their ears can hurt, that sort of thing. And the other thing is just it's something that I never really thought about too much before I had kids, but the plane's loud,
Definitely.
and it's louder than you think. And it's a weird setup for kids that way. And also too, with kids, they can sometimes, some kids, it's like sensory overload almost, where it's like all these weird new things are all around you and these people are around you. And sometimes it actually works to your advantage because they're fascinated and they're just sucking it all in like a sponge. But then sometimes, maybe upsets them for whatever reasons. And then you've got to have to deal with that. And I think with kids, it's keeping them occupied is half the battle now. If you have a child that's under 2, usually they don't have their own seat. So they're going to have to sit on a parent's lap. And there's that. But, there's always, snacks and books and iPads now and everything. So those are all things that you can do, and that usually help and are usually of some benefit. But I think we've all been around the screaming kid on the plane, and it's I don't know, it's one of those things. But I think you try your best to distract, and then the other thing is too that when there's on descent, I think it's always a good idea, especially on descent, but anytime when there's a real elevation change, if breastfeeding is or bottle feeding or something like that, it can be really beneficial and help out a lot. So
definitely, yeah. I think we can all think of a time where we've sat on the plane and had a kid scream their head off the whole time, but it definitely is, like you said, kind of a situation where you don't think about it until you have kids, that it is a disorienting environment and it never really quiets down in there. There's always the hum of the plane engines. There's always people talking. And for some kids, that can be very scary.
Yeah, I think I think sometimes, it's not always predictable either, but, I can remember taking our older daughter when we did a red eye over to London, and she was about a year and a half. Well, maybe a little bit less than that. But anyway, being on the plane, like, she did not sleep the whole night because there was always something to see and there was always something going on. And she was very happy, but was just soaking it all in like a sponge, all the stuff that was going on, because this doesn't usually happen normally around our place,
Right. One thing I might say is that some kids might have more sensitive, might be more sensitive to motion sickness on the airplane. I know from my experience and from traveling with my brother that can be the case.
Yeah, I would agree. That's definitely possible. One of the things that we know about motion sickness is, and this, don't want to go off on a whole tangent on this, but we know as you get older, motion sickness decreases. Like if you're somebody that is more prone to motion sickness, as you get older, it does decrease. And part of that is just the mechanism of action in your ears and as you age. And I used to actually be able to really explain it very succinctly, but I'm kind of drawing a blank right now. But, it is something that I think as younger kids, it's more so, and in older people, it's less so. So definitely something to contemplate.
Definitely. Okay. Is there anything else you wanted to mention about traveling by plane or anything like that?
I don't really think so. I think right now, plane travel's kind of been weird. I know, Jayden, you've recently flown. I flew a few weeks ago for the first time in the pandemic, and it's a little odd right now, but overall, I think I still think plane travel is a relatively safe way of getting around, and as far as catching something on the plane, I think that the odds are pretty limited. So I feel overall it's still a pretty safe way of traveling, but there's certainly some things to think about. And when you're thinking about, travel health, and it's not always just about, the mosquitoes that are going to get you at the location or something you ate that gives you diarrhea. It's the whole package. And when we do a travel consult, we want to talk about all these things, especially if we have people that are more prone to having problems on the plane, or they have blood clot issues. And so, yeah, it's definitely a piece of the whole puzzle that should be contemplated in the process.
Definitely. It's not just about the destination. It is also about the journey.
Oh, that actually sounded very deep and philosophical, Jayden.
Did that sound very profound?
It was profound, yes.
Yeah, definitely. Speaking of flying recently, it has definitely been weird, but it's not any more scary than any other time that you would be flying, in my opinion, at least.
I agree. I know when I flew a few weeks ago, the one thing that I noticed is the airport was so quiet.
Yes.
It was like, I don't know if you had the same experience, Jayden, but I'm walking through the airport. I was like, there's nobody here, which actually is, kind of nice.
Yeah, it's kind of awesome. When I flew out of Montreal, I basically walked straight from the bag drop to my gate. I never stopped. There was no lines or anything like that, which is awesome, because that airport is usually, it can get backed up, especially during busy travel times like that.
Oh yeah, totally. I know, and my experience was somewhat similar, with the exception of going through the gate security, the one time on my way back. Otherwise, I think I didn't queue up anywhere, I don't think.
No, but it can definitely be. I normally find the airport to be stressful, but as of recently, it hasn't really been that bad.
Yeah, I think that's probably a safe thing to say. One thing I'll tell you, and this is just sort of a weird tangent, but I don't know if you ever run into this, Jayden, but I found this fascinating. This is probably like a decade ago or so, and I was flying, and I believe I was in the Philadelphia airport, and they had the strangest, at least to me, airport security measure. You actually went through airport security when you would self-decide how knowledgeable you were, how frequent a flyer you were, and how good you were about stuff. So if you were like with a family, or there was a family line, there was an inexperienced traveler line, a moderately experienced traveler line, and an experienced traveler line. And I remember thinking, this is really strange, but I guess the idea is, if you know what you're doing and you know exactly what you need to pull out, your laptop and all your other stuff, and you know the process, that you could go in the experienced traveler line. But I'd never seen anything like that before. And I don't know if that's still a thing at all, but I remember thinking, this is interesting and different. And this had nothing to do with what do they call those passes? The
Nexus.
Nexus. It was not this at all. It was just you lined up in whatever line you wanted in security based on that.
Huh.
And it was self-determined. Like, no one asked you any questions. You just decided which line was appropriate for you.
That is very interesting. I can't say that I've ever seen that before, because that would be, I don't know about you, but if you've ever been behind somebody who seems like they've never been to an airport before, it's just about the most frustrating thing ever when they're standing there and they don't know that they need to take their shoes off, and then they get turned around, and it's, they don't know they need to take their laptop out of their bag, and they're moving like a turtle, and it can be quite annoying.
Oh, I hear you. I've been there too. So
yeah, I bet you've done a fair bit more traveling than I have.
Yeah, well, that could be a whole topic of conversation one day. All the weird airports I've been in. I've been in some strange ones, I've seen some weird airport stuff. I'm sure that there are people that could easily top many of my stories, but flying in. I remember Vietnam, flying into airports there that looked like they hadn't been touched much since the war, and other strange airports, where former communist era airports in Romania and stuff. There's seen some weird things. Nothing really awful, but weird stuff.
Definitely. And also, traveling can also bring out the strange sides of people.
Yeah, definitely. But I would definitely, circling back to one thing you said before, or we talked about earlier in the podcast was, I think a really difficult, vulnerable time for people when they are traveling is right when they get off the plane in a foreign country, especially if they don't know the language, because
Absolutely.
it's a complete, even if you feel that you're prepared, it is just a complete assault on your senses, new things, new sounds, new everything, communication barriers with language and stuff. It can really be a challenge. And it can even, I think, people who travel a lot, it can mess you up. And then it's a perfect opportunity, because in some countries you've got the scammers. They're waiting outside to get you into their quote unquote cab, or someone's trying to sell you a tour or something like that. Or I've seen these things. It's pretty common, and sometimes if you're not, it's a vulnerable moment for you, and you never know. You might just go along with something that you maybe shouldn't, and it's definitely a concern.
Definitely. There's a lot of scams kind of related to getting in a cab, and they trick you into forgetting your smallest piece of luggage, or they're ripping you off because they realize that you're not from there and you're not going to know what the regular price for a cab or something like that is. And especially when you're walking out either into the dead of night or into bright daylight, it can be very disorienting. And so I think it's something that you need to be pretty vigilant about.
Yeah, I would agree. I've even been in a couple of those situations before. I remember one time I had to take a cab from the airport when I was flying within Morocco, and I think I got into a cab at it was 12:30 at night, and it was a somewhat busy airport. It wasn't like I was the only one there, but you're driving around in the streets, and they're pretty quiet, and you're just looking around thinking, oh, I'm not complete. This seems like it's about the right way to go, but it couldn't be also.
Yeah, I hope nobody murders me, or I'm not being taken to a second location.
It just seems like all of a sudden, someone could just all of a sudden make a left-hand turn and could be anywhere, But fortunately, never had that problem. But think about it.
But yeah, definitely, it's something that you can get yourself into a dangerous situation without ever really thinking about it.
True.
Or perhaps not even knowing that you were in one until it's over.
Yeah.
All right. Anything else you want to mention?
No, I think that pretty much covers it.
All right. Well, thank you for tuning in to this week's edition of the Polaris Travel Health Podcast. A reminder that the information and advice that we provided in the podcast are not a substitute for live medical advice tailored to your itinerary and your medical history. If you have any questions or you want to book an appointment, please head over to our website, www.polaristravelclinic.ca. Check us out on Twitter @PolarisTravelRx and our Facebook page as well. We hope you'll tune in again with us next week.
Thanks, Jayden.
Yeah, thank you.